Hello, everyone. My name is Robert Bednarz, and I am a junior doctor in Dundee, Scotland. And you're listening to the Patient Will See You Now podcast. I have to say, this podcast is for educational use only, and you should not be using this as medical advice or opinion. Please go see your doctor if you have any medical questions. This podcast is supposed to be fun and educational. So now that I got that out of the way, let's get into this week's topic. Hey everyone, this is Robert, and in this week's episode, we're going to be talking about depression. And before I get into this topic, I just want to give a content warning in the beginning, as in the interview, we mentioned suicide and other topics that may be difficult for some of the listeners. If you or someone you know needs help, there is always someone you can reach out to. If you're in the UK, you can call Samaritans at 116-123. And if you're in the USA, you can call the Suicide Prevention Lifeline at 1-800-273-8255. You're never alone, and help is just a phone call away. Depression is a really common mental disorder affecting more than 264 million people worldwide. However, even though it's so common, a lot of people find it a lot harder to understand than, let's say, high cholesterol. A huge misunderstanding is the difference of having depression and just feeling sad for a while. Everyone can have feelings of being down every now and then from watching a sad movie or losing a loved one or for no reason at all. For a healthy person, this lasts for a few hours or days, and once a different circumstance comes up, that'll change how they feel and feel better again. Clinical depression, however, just won't go away. In psychiatry, depression is diagnosed in the following way under something called the DSM 5 criteria, which states depressed mood and or loss of interest or pleasure in life activities for at least 2 weeks and at least 5 of the following symptoms that cause clinically significant impairment in social, work, or other important areas of functioning every day. Depressed mood, diminished interest or pleasure in activities, significant weight loss or gain, inability to sleep or oversleeping, psychomotor agitation or impairment, fatigue, feelings of worthlessness or guilt, decreased concentration, and recurrent thoughts of death or suicidality. It must cause significant distress to the person's daily life, and it can't be due to a substance or other medical condition. It can't be better explained by another mental disorder like schizoaffective disorder, and it can't have a manic or hypomanic episode at any point. So, what causes depression? Unfortunately, we don't have one main cause that we can be so sure on, but it's strongly linked to genetics. So, if a close family member has it, that person has a 3 times risk of having it as well. Biological, environmental, and psychological factors also play a role as well. Depression can sometimes be seen on imaging by showing a smaller frontal lobe in your brain and a smaller hippocampal volume as well. A more popular theory on depression, though, is the imbalance of neurotransmitters like serotonin, norepinephrine, and dopamine. We focus on those 3 neurotransmitters because when we give medications that gives someone more of these in their system, they're shown to be more effective antidepressants. Each neurotransmitter deficiency can cause different symptoms. For example, when you have a deficiency in serotonin, you'll have obsessions and compulsions. A deficiency in norepinephrine can cause anxiety and decrease in attention, and a decrease in dopamine can cause a decrease in attention as well, along with a decrease in pleasure and motivation. There are many different subtypes of depression as well that I won't really get into, but just to name a few, there are postpartum depression, a subtype of depression that starts following childbirth, but onset can begin prior to childbirth as well. Atypical depression is characterized by an improved mood when exposed to pleasurable or positive events called mood reactivity. And dysthymia is used to describe milder symptoms of depression that happen over a longer period of time. Depression symptoms are intangible, so it can be really hard to see somebody who might have depression. Some people might look completely fine on the outside, but they're having some of the biggest struggles in their head. The average person takes about 10 years to seek help for their symptoms. In terms of management, we always want to try the conservative route first. So, for example, we ask the patient to do some physical activity, and that can play a huge role in this as it increases the neurotransmitters and endorphins in the body. Diet is also really important, and just eating more healthy foods like fruits and veggies can help a person with depression to have improved moods. Then we go to therapy and medications, and they show a huge improvement to help boost those chemicals and neurotransmitters that a person with depression might be deficient in. In extreme cases, electroconvulsive therapy or ECT is also very helpful, and it's when the patient gets a controlled induced seizure to change some of the wirings in the brain. It shows to be effective for about 50% of patients, even though it's not really fully understood how it works. Depression nowadays seems to still have a large stigma around it, and it's important for more people to be aware and educated as to how depression affects people. Love and support from friends and family can sometimes be enough for someone who has depression to drastically change. If you are someone who knows someone with depression and you haven't experienced it yourself, avoid comparing depression to times when you felt down or sad for a prolonged period because that's going to make that person with depression feel guilty for struggling. However, talking about depression openly with people has a huge impact and can really help a person with depression. Also, statistically, asking if they've had any suicidal thoughts can actually reduce the suicidal risks. Talking about it more often openly is the only way to beat the stigma. In this episode, I talked to JP, who has lived with depression for what he feels his whole life. He also has a blog and a podcast where he openly talks about his depression to help others who have it as well to know that they're not alone with how they feel and how some people with depression can feel since everyone with it experiences it differently. His podcast is called Depressed, Not Dead, and you can find it on almost any platform. A link will be in the show notes for those of you who are interested, along with the phone numbers if you or someone you know needs help. So, without any further delay, here's JP and his experience living with depression. Hello, JP. How are you?
Good. How you doing, Robert?
I'm doing all right. Thank you for asking so much. So, the way we usually start these podcasts is basically if you can let me know how this all started for you. I know it might be a little bit different for you because depression kind of creeps on. So basically
hmm
let the listeners know when you think things started to change in your way of thinking and when you started feeling symptoms and signs, and we'll just kind of go from there and then let us know as much as you can from there.
Sure, sure. So I am 47 right now, and if I had to guess, and my memory isn't that great for various reasons, probably, I would say depression has been with me as long as I can recall. I certainly, as a child, I was kind of shy, kind of social anxiety kind of thing, but I think it was more just depression, like feeling like I didn't fit in. Never really super happy, never really super down. And so that went through most of my adolescence, my teen years, into my 20s. And then in my 30s, I started having issues with my wife at the time. Our marriage was kind of falling apart. And I think things were really getting down to the nitty gritty at that point. And it was in my 30s that I had my first interactions with suicidal ideations and suicide attempts and things like that. So yeah, I mean, I'd say most of my life, but the really dark, super dark days, probably 15 years now.
So from 47, 15 years ago, about 32. So like you said, in the 30s, that's when it got
Yeah,
really bad, right?
yeah, yes, yep.
So at what point would you say, what was it that made you think, I need help? I think I should go see somebody. When did you think that, oh, I think this is something really off with me?
Yeah, so really it was my ex-wife, the one that I was having trouble with in the marriage. And at some point, about 35, 36, she actually suggested that I go and talk to someone. I wasn't really, it didn't come from me, and I wasn't really aware of being in that kind of situation, right? I mean, when I say back into my adolescence and really starting around early 30s, it's not that I was aware of it at the time, right? I've spent a lot of my life just assuming that, well, this is the way it is, right? I mean, never talking about depression, talking about mental illnesses wasn't really a thing until probably this past decade, right? So there wasn't a lot of conversation for me to realize that, hey, this isn't really how people are. People don't feel this way all the time. So it was probably 35, 36 that I went and saw a therapist, and I got a diagnosis pretty early on of major depressive disorder, which even then at the time I didn't know what that meant. In my mind at that time was, oh, great, how am I going to reconcile with my wife who wants to be around somebody who's titled majorly depressed. So, now since probably 40, I've really come into my own as far as understanding my depression a lot better, realizing how it's affecting me day to day and how it's affected me throughout my life.
So when you went to, was it a psychiatrist that you saw the first time or a psychologist?
It was a therapist and then a psychiatrist.
So what did the therapist decide whether these were like how did they know if this was marital problems or depression, psychiatric problems? How did they differentiate that?
Well, you know, uh, quickly we got into, like the first session we covered marital problems, and I was just a heaping ball of tears the whole, 1 hour of that. And then second session, we started talking about more things, as far as, started asking specific questions like, how long do you think you've been feeling like this? Trying to get into more detail. And it, without a lot of discussion, because again, I was new to it all, and I was going to therapy because my wife wanted me to, right? And I was trying to reconcile that situation. So I didn't ask a lot of questions. It was just, it was obvious to them, the therapist and the psychiatrist, that I was dealing with a lot of issues, more so than just, the marriage, which was most prominent. But as far as how they determined, situational depression versus major depression, I really don't have a good answer for you for that.
Mhm. So, what kind of other symptoms, along with, because I don't want to focus on marital problems because the major
Mhm.
depression disorder is much bigger than issues with just the relationship of your partner. It's a relationship with
Right.
everybody and everything around you.
Hmm.
What else were you experiencing yourself? Like, for example, as psychiatrist doctors, there's something called the DSM, which we
Hmm.
base major depressive disorder off of 5 out of these 9 symptoms, and it's like depressed mood for
Right.
over 2 weeks and
Hmm.
weight gain or loss, decreased interest and pleasure. What were some other things that were different at between your 30s? I know you said that this was pretty much prolonged since your childhood, but was there something
Hmm.
significantly worse in your 30s that it was noticeable that this was getting in the way of things?
Um, so, looking back on it now, like a lot of those marital problems were from me. So, I mean, definitely that was me for many, many years, just not reaching any level of pleasure, right? And this was before I started taking medication, so I had plenty of downs. Like my best day was probably close to your worst day, right? And then everything else was just down from there. If something happened at work, and I would it it, it festered in me for a good long time. And it was never, gosh, my boss is a jerk. It was always, God, I'm such a screw up. It wasn't that my wife was doing something wrong. It was that I'm not a good husband or not a good stepdad. And then into having, we had our own children. So my two biological daughters, it just, it felt like I was always, I was never present. I was always ruminating on all the terrible things as I saw them. Whether or not an issue or a problem through those kind of depressed glasses, everything was terrible. I mean, to put it as blunt as I can, right? There were no silver linings. There were nothing to look forward to. No, the future seemed hopeless. Everything was just terrible, right? I mean, like I said, I think of your worst days, and those are probably some of my better days. So,
I can only I could oh, that my worst days is probably your best days. That's a really big statement there. I can only imagine how that could be for somebody with depression. I know everyone has it differently too. So you
mm,
have these feelings of guilt most of the time. Is that how you would say it? Like you just feel kind of worthless all the time, and this feelings of guilt all the time, and
mhm,
everything you just kind of felt like it was your fault.
yeah, yeah, definitely. And I have this saying that I always feel less than, right? So less than my job, less than any person who's in the room with me. Um, and it's just my my worldview of myself is that I am lacking no matter what I did as a dad. And I tried to pride myself on being a dad. I tried to be the best dad I could, but regardless of the outcome, it was never, I never saw it as being good enough. I never saw it as being worthwhile for most of the time.
Did you ever get comments though of saying, "Hey, you're actually doing really great. Don't worry about it too much. You're doing a great job. You're a great dad." Have you ever gotten those comments before?
Yeah, but they're um, in my distorted way of thinking. It was, well, that person's wrong, or that person just doesn't see the real me. So it was I would twist all evidence, almost basically subconsciously, just to that. Oh, they just don't really see what's going on. Or, gosh, if they really knew what was going on, they would lock me up. Or who knows, right?
And you absolutely believe that as well too. You would say to yourself, they're just saying that they don't really know what's going on in my head, and
Right.
you believe that as well, right?
Oh yeah, 100%.
Does so that is one feeling. But how do you feel about having those thoughts as well? Does that do they really frustrate you, or do you not have feelings towards that, or how does that go in your head?
Yeah. To the point now, it's it's so it's I wouldn't even say it's second nature. It's first nature. It's just my the way the neural pathways in my head have been burned for all these years, right? And uh, I don't think about it. I don't think badly about it. I don't feel bad about it. It just is so rudimentary in my brain. That's just the way it is. That I am this person, like I said, less than, and that's just my station in life. And I am at a point now where I can take a step back, and say, that's probably not right. I probably, look, there's in CBT, there's like, look at the evidence and, really reevaluate, negative thoughts. And, I try that. I take a step back, but I don't, my self confidence is so low that I don't trust myself to be able to see the evidence for what it is. Like if I see evidence that is pointing towards a positive towards me, I must be misreading it. I must be not seeing it clearly.
Do you ever actually get joy from any of these comments that were there any spurs of moments like, "Oh, yeah, that person's actually right. I am doing a great job." Are there ever those kind of moments for you?
No, I none that I can remember for my life. Um, I have different accomplishments and things like that. But my wife now is the most caring and supportive person in the world, and I respect her and value her opinions. But even when she says, "Hey, you're a good husband," I have that. If you really knew what if you really knew the real me, and a lot of our relationship now is kind of like blind faith. Like I have to take her at her word, whether or not I believe it or not. And I try not to question that. I try to leave this relationship away from that. But anytime she says something positive, it's that same thing. It's just, hey, if you knew the real me, if you knew really what was going on. That goes into fatherhood and employment and friendship. Any kind of social interaction is is that same way. And any comments about any of my accomplishments are just I I devalue them externally and internally.
For a lot of people, when hear depression, they have this picture in their head of somebody sad in their room doing nothing
Mhm.
or laying in their bed.
Right.
But you seem to be functioning, like, you're going to work, you got married, you have kids,
Mhm.
and how do you manage to go day by day with all that? And also, did you have any feelings towards getting married and having those kids? How did you feel during those moments as well?
Yeah. So as far as functioning, I think a good deal of that was just how I was brought up. Right. I mean, I was brought up to go to school, go to college, meet a woman, get married, have kids. Right. So it was I was just following the script. Right. It was almost like I was offloading decision making to what the it's not quite the American dream, but the American dream, what that is, right? What that represents, and in the path that stereotypically, historically, white American men take, right? And then, as far as feeling on like the birth of my children, the two times I've been married, I've had no emotional response to any of that. I was present for both of my children being born, and I was just there. I didn't, I didn't, I wasn't joyous. Didn't weep with, cry in joy or anything like that. My first marriage was really, I don't even remember most of it, but I didn't, it wasn't like that overwhelming, fist pump joy, like, hey, I got the girl of my dreams or anything like that. And my second marriage now, who again is, my wife is just fantastic, but there was no emotion tied to that either. Either the days moving up towards it, we had this big event. We got married at Cape Cod on the beach, and friends and family uh, out in Massachusetts with us, and it was just okay. It was a Saturday. It was really what it was.
It just felt like another day to you,
Yep.
just another day to go by. This is part of the plan. Get married,
Yep.
have kids.
Hmm.
Do you have any thoughts for feeling that way during those moments?
I mean, like I think about how I should feel.
Yeah, kind of
Is
like,
that
or why don't I feel anything at this moment? Do you ever self-reflect and think about those moments, or tell yourself I should be feeling a certain way but I'm not?
um I haven't. A lot of times I feel like I'm just trying to get out of my own way, like to get through the day, right? And wedding day, it was okay. We're gonna walk down the beach. We're gonna meet in front of the person marrying us. Friends and family will be there, and I have to say I do, and I that's what I focused on, and you know, that was it for the day. I didn't take time out to say, hey, I should be feeling a certain way. Um, there was lots of emotion at the wedding. My youngest biological daughter was she was there. She was in tears the whole time, and just in joy, not in sorrow. And I felt nothing for that. I have this way of speaking that I cognitively understand how I should react to situations, but emotionally, I don't have a clue on what I should do. So if someone's upset, I cognitively I know, okay, they need some kind of counseling, some kind of tenderness, something. And I try to offer that as best I can, but I don't have kind of any empathy for the situation.
So you kind of put on a mask during
Yeah.
certain situations. So, for example, if you're going to someone's birthday, for example, you know that this should be a joyous occasion. So I'll throw a smile every now and then.
Yeah, I'll try. Um, I I'll laugh at jokes, right? Because it's the social cue is pretty obvious when someone's making a quip or a smart remark or something. But as far as being in a happy situation, I don't I don't feel those cues to smile. So I'd be generally flat affect,
So you're
and
more
then
it's more of a logical thing. Like I know the punchline is going to be here. I should probably
mhm,
give him a chuckle or a smile at this moment
right,
instead of actually thinking, "Oh man, that's really funny." You kind of
right.
just put on this mask, this act of I'm just going to give them what they want.
Yeah, or that's a fitting in strategy, right? So if,
Gotcha.
if I laugh at the right point, then I fit in.
Have you ever felt happy? Do you remember any moment at all where there was like a spark of joy, like a hobby or a moment or anything like that that gave you like that small spark that kind of gave you this faith or hope of happiness, anything like that?
Yeah. So in freshman and sophomore year in high school, I fell into basketball, and I was pretty decent at it, and so I spent most of my time playing basketball. Um, I can't say, looking back on it, that I got joy from it, other than um, it was something that I was good at, and so I kind of clung to it, right? Um, other guys at school, they didn't, we didn't have to be social. We just had to play another game of basketball, and I was MVP of my team, all these different things, and nothing of joy from that. Um, Shortly after college, I lived with uh, my best friend now. His name's Dave, um, and like that's probably the one time in my life when I can look back and say I was kind of happy. Um, we just kind of hit it off as far as personality wise, and he was genuinely funny to me. Um, and we did goofy stuff, and for the most part, I followed him. Everything we did was kind of his idea, and I was more than happy to just go along with it because it was a safe relationship emotionally. We were kind of awkward early 20s guys and didn't talk about emotions. We didn't have to do that. We just had to watch The Simpsons or go and play some basketball or whatever. And I can remember a few times in with him where that kind of genuine joy of you start giggling and you can't stop giggling, and the more you try to stop, the more you laugh, right? Kind of almost schoolboyish kind of attitude.
And he's currently
And
your
that was,
best friend now as well?
yeah, yeah.
That's really nice to hear, at least. Like, out of all this darkness so far throughout the interview, with you living with depression, at least there's this glimmer there with your best friend and that he's still there next
Mhm.
to you. Because a lot of people who knows somebody that has depression, their loved ones or someone close to them, I'm sure they really understand the frustrations and how difficult it can be living with
Mhm.
someone with depression as well. It's because you really care for them and you wanna help them out, and it's really nice that he's stuck around and he's there for you, and he's also making you happy, and you get, like, those small things matter. Absolutely.
Mhm.
I'm sure you appreciate those moments. Uh
Yeah, absolutely. Absolutely. And I as far as, him being around, still, and, like, with my wife now, it's just, like, I give all credit to them for being such good people, right? And this kind of flows right back into not giving myself credit for anything. Like, there's I can't take credit, or I find it very difficult to take credit for being the kind of person that they wanna be involved with. I credit it all to they're such good people that they're willing to put up with me almost.
One thing that you mentioned earlier is that this whole depression thing kinda it's getting more talked about within the last decade,
Mhm,
and I'm only 29 years old, and I know I've been growing up with a lot of my friends who have depression, and seeing people who have depression as well, and that stigma and taboo of it all is it's still there because a lot of people I
mhm,
see, they're just like, "Oh, just get over it. Oh, just, just be happy, just stop being sad," which is ridiculous
right,
because it's
right.
if it was that easy, then everyone would not have depression. But I'm curious as to how it was for you when you were younger, when you were in your teens and your 20s. What was it what was the idea of depression like then, around you for somebody who has depression? Like, what was your family thinking? What were your friends thinking? How were people treating you then? Because obviously the how people treated depression then is much different than now. I feel like it's more openly talked about now than it used to be.
Right,
How
right.
what were some of your experiences when you were younger with it?
Yeah, I mean, so keep in mind that it just really wasn't talked about, in the '80s and the '90s. I mean, maybe late '90s, it started becoming more talked about, but, I never considered myself as being depressed or having a mental illness or, um, really, um, being maladjusted, we'll say, which is probably a bad way to put it, but um, not being neurotypical, we'll say. Um, and so, I felt like this is what I'm supposed to feel like, and this is just the way it's supposed to be. Um, I went through stereotypical thought processes of not understanding when people meet each other that they're all smiles and happy. Um, like I always assumed that that was a social norm, like you just acted that way because you were supposed to. It was foreign to me that someone would be happy to see another person. Like, you meet your friend and you're so happy you just smile and you give them a big hug. And that was foreign to me and it seemed like an act. Like I thought, wow, these people are really good at fitting in. Um, but I think, I got by on a lot. My dad was a very gregarious kind of guy with a sharp wit. Um, and I kind of got that from him. So I was always quick with a joke, um, which, like I had a basic understanding of how humor worked. And so that was my mask. That's how I hid. That's how I kept people from getting to know that real me, who, if they found out they wouldn't like, um, was just by telling jokes. And, I don't think anybody really would have known. I've talked with some of my high school aged friends, um, and discussed with them, hey, I have depression. I've had suicide attempts, and what do you remember of me from high school? Um, and this was kind of a longer journey I was going through to try to recap some of my youth that I have such poor memory of. Um, and to a person, it's I really had no idea. I wouldn't have thought that you were kind of quiet at times, but you know, you they just didn't have any clue.
Mhm.
Um, so it really, like, I didn't face stigma because it just wasn't talked about and it wasn't there. And I suppose, I guess the stigma then was that we don't talk about it. But I think I think because it wasn't talked about, I didn't understand that that's what I was dealing with.
So that's kinda
You know,
curious because it's either it's kinda like going from people just didn't talk about it to now some people are talking about it, and the ones that's never heard of it before are thinking, "Oh, that's a fake thing. You're just being sad. You'll get over it."
right,
And I think that's that constant fight where people back and forth are saying, "No, this is a mental disorder. This isn't just fixed overnight." And then some people saying, "Yes, it is. I think you're just sad for a little while because something happened that because of a breakup or a death, and you'll get over it soon," which obviously isn't the case here.
right, right. And so, I mean, that's you're describing situational depression, right? So something, death of a loved one, or a breakup, or losing a job, something like that. Um, and I think the whole word kind of depression or depressing is kind of, there's a slang used to it, right? Like you'll often hear someone say, "Oh, that's depressing," right? And like, I don't, to me, depressing isn't really a word that has value anywhere because I don't see an event as being depressing. Even though I've just talked about situational depression, but I don't think like that's a depressing issue or something like that. To me, depression is this innate kind of, for me, I believe it's mostly a chemical imbalance, although I'm learning that that's probably not entirely the case. But so, I mean, there's stigma there, right? I mean, it drives me drives me up the wall when I hear someone say that's depressing, or so and so is so manic depressive because they change their mind all the time.
I actually
When
never thought of it that way because there are like I'm guilty of it then myself too, of course, because like there are times where I listen to a really sad song or I just came out of a sad movie and I would come out of it
Mhm.
and I would just say like, "Oh man, that movie was really depressing."
Right,
But
right,
obviously that's just another it's ignorant of me for to say that as well because depression is a more serious thing where people really live with it and it could be it's not the same. It's absolutely not the same. Saying that was a sad movie, yeah, but saying that's a depressing movie, I think would be coming off a little bit too strong. Is would you agree to that?
yeah,
Yeah.
yeah, and I think that's kind of what lends it to what you were saying about people think you can just get over it, right? Because you go and see a sad movie, and oh, that was depressing, but an hour later, you're at dinner with your friends and having a good old time, right?
Yeah.
So I think it lends itself to that idea that you can, quote unquote, snap out of it. And, go for a run when you're feeling down and you'll feel better. Or with my parents, it was always, take your medication, and they thought if I was taking my medication, then I was fine, and there weren't, I wasn't struggling anymore, and that's just not the case. And they thought, well, if you miss a day of your medication, then you're going to go off the deep end. And most depression medication doesn't work like that. It's a cumulative kind of medication that builds up in your system. So missing a day, while emotionally may be anxiety causing, really, as far as your medicine protocol, it's not going to throw you off. It's not like an antipsychotic medication.
Yeah, it's not like if somebody
So
has high cholesterol, we could just give them medications that'll lower the cholesterol. Problem
right,
solved. Yeah.
right, yeah.
So I know I've asked about your happiest moments that we would look for,
Mhm.
but what were some of let's go the other way. What were some of your you would say what your darkest moments were?
Um, so I mean, obviously, when I went through a long period where suicidal ideations were just a fact of life. Um, and but there weren't situations that caused that. Um, as far as sad, pure sadness, depressive sadness. Um, it's been so long since I've really experienced an emotion that I don't know that that I could give you one. I've had intrusive thoughts lately, well, within the past year, having to do with my children and bad things happening to them. And those were the only times that I've been brought to tears in probably the last 5 years. And they were just intrusive thoughts of, my we went on a cruise and I had this thought pop in my head. My youngest, fell off the boat and she's in the middle of the night in the dark in the ocean and how horrible that would be. And I couldn't get it out of my head. And, I'm guessing you're sitting there thinking, well, what makes a person think that? And, I don't know. It just popped in my head and it wouldn't leave for a couple days. So those were really emotional times. But as far as like with my last uh, suicide attempt, the month leading up to that and the months after that were my darkest times by far. Um, I was researching ways to kill myself, on the internet, looking things up and finding the best way. What's the least messy way? What's the fastest way? What's the most uh, probability? What has the best probability of being successful? And I was doing a lot of isolation then, and I really the only things I remember from the 5 weeks leading up to my last suicide attempt were just those things, researching ways to do it. And I was living in the house with my now ex-wife and her two kids from her previous marriage and my two kids, and it was a full busy house, and I had responsibilities driving kids to school and things like that. But I know I did those things, but I don't remember those things. I don't remember, eating. I don't remember sleeping. I don't remember anything. I mean, I know I ate. I packed on like 20 pounds in about 5 weeks, 6 weeks. Um, but I don't remember anything else from those days.
So I remember in medical school, we were taught in the emergency department of the class, like emergency classes, when
Mhm,
somebody comes in after a suicide attempt, one of the questions we would always ask is, "Did you have a plan? What did you
mhm.
have a plan of how to do it?" So did you? So I guess I'll ask you that now. That last suicide attempt, did you have a plan in mind already?
Oh yeah, I had planned it. It was a plan of opportunity, which involved medication I was taking and being overprescribed. So I had an abundance of a particular medication. Um,
Mhm.
and I had it planned out. I didn't have it necessarily planned out that I recall for the day that it happened, but it was this is what my plan's going to be, and it was you know dropping off the grid for the day, right? So leaving my credit cards and took the SIM card out of my cell phone and drove across the state of Michigan and um, you know crushed up pills, and I had a plan, and I took anti-nausea medication because I didn't want to throw up the medication. I wanted to be successful. Yeah, it was not a spur of the moment kind of thing. And I know of lots of survivors who have lost people to that kind of spur of the moment kind of decision, but it wasn't for me. It was planned out, and it wasn't. Um, we talk about being in crisis. And even though I was clearly in crisis, I didn't feel like anything was different. It was, I say that, that day was like going off to kill myself was like taking out the trash. Like that was just what I was doing that day. Got up, took the kids to school, went home, emptied out my pockets, and just took off. And it was, no more anxiety ridden than doing anything else, doing the dishes or whatever.
And after all of that, obviously you're still here today, and
Mhm.
I'm so happy you are that it didn't go through. But I'm just wondering, was there something that told you, "Hey, don't do it"? was there something that said that's told you, like, "Don't do it, just stop, turn around, there's another day coming forward." Was there anything like that going on in your head?
No, no, I mean, that whole day was just from what I remember, because again, a lot of that day is a loss, and a lot of it I've pieced together from talking with my ex-wife and my wife now, and things that they found out. Um, I guess the only time that came up, and I don't recall this, but apparently I put a post up on Craigslist, um, looking for someone to talk to, um, and I posted a picture of the medication I was going to overdose on, and I don't recall now if it was, "Hey, I need help," or if it was just, "Hey, someone talk to me." Um, and I guess that was the night before. Uh, but everything past that, no. And and I went through with the plan, um, and it turns out I had done it all in the parking lot of a major retailer at night, and apparently I walked myself into the establishment, and they called paramedics and got me to the hospital. Um, but I don't have recollection of, was that a, oh crap, what have I done? I got to go get help, or if it was, I was thirsty for some soda. I really don't know. Um, but had I chosen to do this off in the middle of a campground somewhere, I probably wouldn't have been successful, or I would have been successful and not have been rescued.
Well, whatever the reason is, I'm glad you went into that establishment and they called for help. Otherwise, you wouldn't be here talking with me today, talking
Right.
about your experience. It's really interesting that you have no recollection of that day. It's just a complete haze that somehow, somewhere throughout the day, you subconsciously made a Craigslist post with your medications and stuff on there.
Hmm.
That that's I don't even have words for that. That's just really interesting, and it's just like a wow moment for me that, like, hey, you did there was somewhere in your head asking for help. You just don't seem to remember it or recall it at all.
Right.
Were the days less hazy afterwards?
Um, no, so I woke up in the hospital, and I'm still not clear if it was the next day or the day after. Um, but I was in, obviously, it was a big haze at that point. Still kind of reeling from the medication overdose and things like that. Um, it took me a little while to realize that there was a woman sitting in the hospital room with me at all times. It took me a while to figure out. It was weeks later that I realized that they were watching me. I was on suicide watch while I was in the hospital. Um, at some point, I recalled my friend Dave, his phone number, and I felt the obligation to call and let someone know that I was around. Um, and then things kind of fell into place from that. And my now wife, who was my girlfriend at the time, came out from Minnesota to Michigan. And then I was obviously transferred into the mental health ward at the hospital, which I don't remember much of that. I don't even remember, my girlfriend at the time being there and coming to see me. My parents came to see me. I don't remember seeing them. Um, I think I was in the ward for 5 days, maybe. Um, my friend Dave came to see me. I don't remember that. Um, and then the decision was made, um, between in big technicalities, my wife and I, we were still married, not living as a couple, but living in the same house for the kids' sake. Her and my now wife um, made the decision that, hey, maybe JP should go off to Minnesota for a while to kind of get away from everything and work on himself. Um, and I don't remember the first few weeks of that. Uh, I remember distinctly we were driving back. through the UP of Michigan, which is all wooded, um, and having the strong urge to, my wife Nora was out in front of me, um, and had the strong urge to kind of turn off and just start, hightailing it up another road, and just disappear. Um, and I'm not sure why I didn't. I think I thought because Nora would get mad at me was the real reason that I didn't do it. But all the days for months after that were just filled with suicidal ideations and troubleshooting my suicide attempt. Like, what did I do wrong that made it so I didn't die? Um, and it was different therapists and partial day programs at hospitals and trying this medication, that medication. But it was quite a few months before I was, uh, I don't know, normal. It's such a terrible word to use with mental illness, but
Mhm, mhm.
to a point where I was functioning, um, aside from getting up and eating and going to therapy, coming home, going to bed.
Besides therapy and taking the medications, are is there anything else that's helping you manage it day by day? Is would you say that your social network, your friends and family help? Do you exercise at all? Did you change your diet? Did you do anything actively to try to change anything? Or and I guess another thing is, are you currently taking many medications for it? I guess main question is, how are you managing it day by day
Mhm.
now?
Yeah. So the ironic part of it is so it's January 2015 that was my suicide attempt. All of 2014, for the most part, was what I dubbed the year of JP. Right, I was meeting my current wife. We were kind of falling in love over the internet. I said started dieting that Thanksgiving before. I got into running. I dropped like 40 pounds. I ran a half marathon. I was, generally feeling pretty good at work. I had stepped down from a supervisory position to just a normal associate, um, which made me, the most uh, qualified associate in the building. So I didn't feel any kind of pressure. I wasn't questioning myself that much, because I worked retail and it was kind of in my mind Mickey Mouse kind of stuff. Um, and like I was, I was at probably the peak of my physical and probably at the time emotional prowess. Uh, and then I stepped back up. The opportunity came to get promoted, and I took that. And it was pretty short after that that I started, um, all the kind of creepy demons started coming in of low self-esteem and not knowing what I'm doing, and I'm a fraud. Um, but I was still falling in love. I was still running. And I ran my half marathon, and I stopped running, and so I lost that. And things just got dark really fast. Um, so in the time since then, I've put that 40 pounds back on pretty much. Um, I try to run. I'm older now than I was then, and I have different physical maladies that get in the way of exercising as much as I would like to. Um, I do take uh, 3 depression medications, and a fourth one, trazodone, which generally is given for sleep. It's technically an antidepressant. So I take 4 different medications a day. I At the start of last year, so 2019, I had a switch of medication, and within a week of switching medication, like for the first time in years, like suicidal ideations just disappeared. They just popped right out of my head. Um, I stopped. I was looking at all kinds of things. If I was out walking and I saw a bridge, I would make a note of how high that bridge was. If I was in a new building, I would check to see what the stairwell was like, to see, is there space between the handrails to fall down. Everywhere I went, um, I was thinking, okay, how do I what's my suicide plan here? Um, and I switched medications, and it was like an epiphany almost how they just disappeared, um, which is great, and I'm very thankful for. Um, and that's pretty much all they do for me. I don't know that I get much emotional balance from them, but just having those ideations disappear is huge. Um, and it's rather pricey medication, but it seems worthwhile. Um, my wife is my biggest social connection. I know I could reach out to my friend Dave or my mom or my brother, but I won't do that. Um, Still, for fear of proving myself to be a jackass or less than. Um, but I there's just something about my wife, kind of interconnectedly between us, that I don't suffer that quite as much with her, and I feel comfortable speaking to her about different things. There's still quite a bit I hold back, um, but she's just has a way about her. Um, is that Billy Joel song, right? um, so I try to run, I try to exercise, I do. I'm I'm pretty big, actually, socially connected. I do a podcast about my depression, um, and I have a lot of listeners and devoted listeners who, I have a text line, a Google Voice number that I get. I have probably 18 different people who text me, at different times, um, and I've probably benefited more from doing the podcast than I think, um, and I think it's because I feel like I can try to put some of my experience towards helping other people. Um, so yeah, I mean that's probably my biggest social interaction, and it's like a half interaction, right? Because it's not anonymous. They know my name, but like we'd never met face to face,
Mhm.
and there's never really a voice conversation back and forth, right? It's they text me, and I've got time to think about how I want to respond, so I can skirt the edges of revealing too much about myself while still giving advice. Um, so yeah, I mean, I probably don't embrace it as much as I could to get full benefit, but I think that's probably the biggest non medical related way that I gain benefit.
That's actually really, really nice hearing that. It's how you a how strong of a support system your wife is. I,
Hmm.
like I hope she listens to this eventually, and she knows how much she means to you. And also this podcast that you were mentioning, and I was gonna say, how I'm really happy that you're a guest on this show today,
Hmm.
because I'm hoping that other people will listen to this, and it'll spread the talk about depression, so the stigma is taken away, and people will be able to talk about it more freely and openly, so that it's not it shouldn't be a secret. People should reach out and try to find help, and
Hmm.
talk about it, and other people who don't have it shouldn't feel uncomfortable around it as well either. There should be ways to know how to help people who have depression as well. I think what you're doing is a really positive thing, and it's nice to hear that there are still positive things in your life, even though you're surrounded by this darkness.
Hmm.
It's
Yeah,
it's
thank you.
really nice to hear that.
Yeah, yeah. I mean, as far as the stigma, like, it would be nice that someone could tell their friends, like, they have depression, like, they tell them they have gallstones, right? Or
Yeah.
kidney stones or something, or arthritis even, right? I mean, people always say, like, it should be talked about the same as cancer and things like that, but, there's still people who won't talk about cancer when they have it. But, you wouldn't think twice about complaining about gallstones to
Or
your
lower
friend.
back pain or something.
Yeah, yeah, exactly.
So I guess my next question is just a few more.
Mhm.
I don't want to take too much of your time. But another question is when you do tell somebody that you have depression, do you have an expectation or do you want them to treat you a certain way? Like, how do you want people to treat you when they find out that you have depression?
Um, well, so that's kind of a mixed bag because I still kind of self stigmatize. I work, but I work part time. And when discussion of that comes up, I still phrase it as like I'm a graduating stay at home dad, right? And people tend to understand that, like, oh well, you're lucky you got to, raise the kids kind of thing, which was a big part of my role early on. Um, but I have a hard time saying, well, I deal with depression and other, mental issues, and so I only work part time. Like I stigmatize myself still, um, because I don't know how they're going to react, as far as how they, react to the news that I have depression. If I'm in a different situation where we're not talking about, um, my contribution to society, we'll say. I don't have a problem explaining that I have depression, that I deal with things, and I don't expect people to treat me differently in that situation. So it's kind of a weird, right? It's a weird bag of, sometimes I worry what people are going to think, and sometimes I don't. And I think as long as I'm not, um, there's no risk of being judged as being a drain on society or not. I mentioned being a white American male. Like, you're not. What do you mean you're not working full time? You're 47, you're middle aged, and you don't have a job. And like I still shy away from that. But if we're, a new acquaintance who's borderline friend, I don't have a problem talking about it. I don't have a problem with my employer knowing, because I feel like they should know, because there are days, I often say, like, I've never been so physically sick that I couldn't work, but I sure as heck have been, mentally ailing enough that I've called off of work, you know, dozens, if not hundreds of times. Um, and I feel a little bit like I'm, um, uh, advocating for those mental illness if I talk to my employer about it. Like, so they're aware, hey, I've got employees that are struggling with this illness. Um, but like this past summer, we moved to a new neighborhood, uh, my wife and her two kids and I. And there are people that we meet, and I skirt around the whole work situation because, I guess I'm embarrassed at some point that, I'm not able to, um, perform at a full-time job without fear of kind of devolving and falling into those same traps with the pressure and the boss thinking I'm a jackass, or, figuring out I'm a fraud. And, I work part time in a relatively low stress job where I'm kind of on my own. Um, I'm fortunate that I found a job like that, so I can bring some money in. Extra money in the household's always good. But I'm also fortunate that my wife is able to be the breadwinner for the family, and she's comfortable and embraces that role.
It's actually interesting that you mentioned one thing about work because when some people when they call into work, it's usually something grossly visible that that's happening to them, that they're sick, like they either have the flu or some kind of food poisoning, so they have diarrhea and vomiting or something like
Hmm.
that. So it's something grossly visible that's changed. But with a person that has depression, they show those acute or quick changes much differently. Like nothing is physically happening to them. It's all very mental, and
Hmm.
it's making you unable to work that day because it's just like a lack of a better word, like a flare up.
Mhm.
on a
Yeah,
worst day of your depression that you're just unable to go to work that day.
yeah, and a lot of people would who deal with depression will tell you that it it almost presents as it can present as a physical ailment, like, you just physically cannot move, you can't get out of bed. It sounds so strange to people who haven't experienced it. What do you mean you can't get out of bed, right? I mean, I have been deep enough in depression where I have, like, gone hours of needing to go to the bathroom, but, like, I just couldn't get myself to move out of bed to walk the 10 feet across the room and go into the restroom. Um, and a lot of times with depression, it kind of manifests itself. Like, it feels like it's like your body just will not function for you. It's it's an impressive kind of symptom of depression.
On top of all that, and when you're more or less comfortable telling people that you have depression, like at work and some near
Mhm.
acquaintances, what are some things people shouldn't say to people who have depression?
Uh, well, I mean, the typical ones are, cheer up or choose to be happy or go take a walk and you'll feel better or put on some happy music. Any of those kind of things are um, just terrible. Um, and like, don't say like what they're going through unless you can really say what they're going through. Um, being sad because your favorite neighbor moved away is not the same as thinking your life is not worthwhile at all, and that living just seems pointless, right? I mean, those things are not the same. And not to say if someone is depressed, they're at that point necessarily, but there's shades of that. Like like I try to go on different social medias and like if there's a depression group or things like that, I'll see someone who's really struggling and I'll try to reach out to them. Um, but you can tell um, when someone is really struggling with depression or if they're just sad, right? I mean, the average person with depression probably wouldn't characterize themselves as being sad. Um, they probably would characterize themselves as being worthless or um, life having no point, which are sad things, but it's not the stereotypical, laying in bed crying, right? I mean, those days come and they come for everybody, right? I mean, the most neurotypical person has a bad day when they're sad,
Mhm.
right? So, a depressive person is sad at times, but it's not a pervasive sadness where they just cry for days on end.
This might be a dumb question for asking, but have you ever felt situational depression on top of your depression? So, for example, loss of a loved one, or um, I don't know, seeing a sad movie, or something that is upsetting on top of your
Yeah.
depression. Have you ever felt something like that before?
Um, no. Um, so like when I look back at like grandparents passing, like I was at a point in my depression when like that didn't affect me at all. This past September, my dad passed away, and I haven't mourned or grieved that at all. I've just been what is now my typical emotionally flat about it. Um, so no, I mean, I wish that I would. Like I'm at a point where I wish that I could express some feeling, positive or negative. Um, but um, I guess the only time being, I guess we go back to the my first marriage kind of falling apart, and like I remember one specific night when I was just in a ball of tears and a mess, and I'm not religious, I'm quite atheist, and I actually, you know, reached out to a God, like, hey, if you're there and you can help me with this, I will change my ways. Like, I was willing to put a change of heart of my wife as reason to embrace spirituality. Um, I was that desperate. Um, so that was probably a time when the situational was piling on, um, to my depression.
Mhm.
Um, but in since then, and we're still looking back at uh, early mid 30s, 34, 35, when that kind of stuff was going on. Um, so no, and in a nutshell, I'd say no, not
Gotcha,
really.
yeah. So, we're gonna slowly wrap this up, and
Yeah.
usually how I the last question I usually end all these podcasts sorry. Usually the last question I ask, to my guests on this podcast is, do you have any advice for people who are living with depression or people who are living with a loved one who has depression? Do you have
Mhm.
any advice for them on how to go another day, how to get away or stop thinking about those suicide attempts that they might have? Any kind of advice or just words that you would have on your end for them?
Yeah. I mean, the biggest thing I think you can do from either side is to talk, right? Just if you're suffering, if you're dealing, talk about, if you can, talk about it. If you can't, just talk about anything, because you know, I mentioned that I did the podcast. I do the podcast, and like the biggest thing I hear is that people didn't realize that they weren't the only one who felt this way. Um, so I think any kind of connection, if you're talking about just the weather or the Super Bowl or you know anything, the Donald Trump impeachment, whatever kind of crappy thing you can talk about, if that's all you can talk about, talk to somebody. And if you're supporting someone who's dealing with it, um, maybe not talk as much, but um, talk enough so that those you care about know that the lines of communication are open, and if they want to talk, that you're ready, and be ready to listen to them talk. And active listening, um, is really a lot. Like, you don't always have to reply with something when someone who's dealing or suffering talks about something. you know Maybe just a hug or a smile, or a frown even at the right time, showing that you get what they're saying. um, and if you're suffering, if you're dealing with it, and you can't talk to your loved one because you're in a situation like me where you don't want them to think you're a total loser, um, try to find a therapist, try to find somebody else, go on Reddit, go to the depression Reddit and reach out. Just connect with someone, because that feeling of being alone is terribly strong. And I've been there, and you feel like, that kind of stereotypical teenage kid thinks like parents can't understand what they're going through. um, you feel that way when you're in the throes of depression, that no one really can understand what's going on with me, and if they did, they would think that I'm a terrible person. So talk, talk, talk.
I absolutely agree, and for anyone listening, it's always good to talk about it, reach out, please find help. And JP, I just like to thank you so much. I really appreciate you being a guest on this podcast. I know talking about it can be really difficult for a lot of people, so I appreciate it even more for you to explain what it's like living with depression. Everything that you said was there was a lot of powerful moments, and I really hope that in the future for you that those phrases of "I always feel less than" will some point turn into "I'm more than." I really hope
Yeah,
that for you. I'm really
thank you.
happy that you have a great support system like your wife and your friend Dave. And also, I hope that that year of JP in 2014 will someday turn into the life of JP.
Thank you. Thank you. That's nice. I appreciate that. And I appreciate you giving me the chance, the platform to talk about it. The more voices we get out there, the better. The better the opportunity is for everybody.
Absolutely. JP, is there anything else that you want to mention on the show before we head off?
No, no, not at all. I think this has been fantastic, man. I appreciate it.
Thank you so much, and I appreciate it. Have a good night,
Yep.
JP.
Thanks, you too.
If you liked this episode, please leave a review and also make sure to subscribe or follow on whatever platform you're listening to this on so you can catch the future episodes as well. If you want to be a guest on this podcast, please send me an email with a background of what disease you're living with to thepatientwillseeyounow@gmail.com, and I'll let you know if you're selected to be on the show. Don't worry if I haven't gotten back to you right away, because I might get you back for a later show. And if your condition was already mentioned on the show, no worries. I like to show how one disease can affect different people in completely different ways. Again, thank you so much for listening, and catch you next week.